our show. We are back, but this time I have a doctor in the house and my dear friend for like coming up on 2 decades now. We've known each other for a long time. Dr. Bronwyn Hill, thanks for joining me. I don't think I've ever called you doctor.
No, I'm glad you don't.
Now I'm going to start calling you doctor on weekends and at parties. I'm like, doctor, hey doctor.
The women I work with, my patients, my clients, I always say, just call me Bronwyn. I'm more comfortable just being called
Yeah,
Bronwyn.
you know what? Knowing you as well as I do, that actually makes a lot of sense. So we're going to just stick with Bronwyn then for this episode. Yeah. You are a naturopathic doctor.
Yes, I am.
I want to, first explain to the audience what a naturopathic doctor is, if you don't mind.
Okay. A naturopathic doctor is a regulated healthcare provider. I like to just put that out there first, meaning that we're regulated the same way doctors are and dentists are and chiropractors are. But I think there's very common sort of associations that come up with it. Naturopathic doctors are primary healthcare providers, but we have a different toolbox than conventional medicine. It's interesting you're asking a question to open that. Honestly, my definition of a naturopathic doctor has sort of changed over the years I've been doing it. Okay. Like I've been doing it for a decade. It speaks to sort of personally how my practice has evolved, right? So there's core principles involved in it that sort of like the body knows how to heal itself, just give it the tools to do so, right? These kinds of things. Doctor as teacher is a big one.
Doctor is teacher.
Doctor as teacher.
Oh, as teacher, okay.
As teacher, which speaks to the point that I think, and I do believe this, like a core of my practice is that I educate women, right? And it's not about that I necessarily even use the tools that I have, which are maybe a herb or a nutrient. It's that I educate them about the options, all of the options that exist, and help them make a truly informed, empowered decision about it.
You know, it's kind of funny. This morning, as I was helping myself to some coffee, someone's like, "Oh, like you're so dressed up today for work," and I said, "Oh, I'm like shooting a podcast." He asked me what it was about, and I said, "I'm having a naturopathic doctor on," and he's like, "Oh, like you can kind of tell there is some confusion in the marketplace." Like He was like, "So what are your thoughts on it?" Like you could tell he looked at me like as if it's like a major underlying belief, and I said, "Well, she's part of like anyone, like she can be a part, not the only part of someone's like practitioners that they go see, and I don't feel like you stop people or prevent people from going and seeing medical doctors."
No, I think you're bringing up there a really important point, so I'm glad you did, because I probably would have missed it otherwise, that we are not an either or. Like, I think it's easy for people to think naturopathic medicine is like, it's against the grain and it's like alternative, and it means it's like you either do this or you do that, right? And there might be some naturopathic doctors that work that way, and maybe their beliefs or what they teach are not personally things that I resonate with. And once again, it's amazing to think I've been in practice now for 11 going on 12 years, which makes me feel old. But it really evolves as you're in it and as you do the work and like you're in the muck. But we are not either or.
And it's science-based, right? So it's science
I
changes.
consider myself an evidence-based, evidence-informed practitioner. Okay. Whether that means looking at evidence for conventional medicine that I actually can't prescribe. But once again, it's important for me to have a depth of knowledge, because sometimes those are the best options for people. And they might be coming to me hoping that I have a magic pill or a totally different solution. And I don't think that's always the case, right? There's a ton of nuance.
When you started, for sure. When you started speaking today, you said, you have a certain set of tools or different types of tools or additional tools. And it's funny, just in the work that I do, working with real estate agents and helping them train, a lot of times we always talk about just having different things to pull from. So it's not about like you only have a hammer and that's the only tool that you're ever going to use in every situation. Totally. It's like sometimes you need a hammer, and you also need to throw in a wrench in there. And there's all these different things that you can combine depending on the situation. I think where people sometimes have a hard time with health, and I'm speaking from maybe some experience because my undergraduate degree is in nutrition, and what I just felt was people really want that, not just the blue magic pill, but the one answer, the one size fits all. And it's like, if I'm going to be healthy, this is the answer. And you hear a lot of preaching in this field, right?
I'm going to say right there that I fundamentally don't agree with that statement, right? Or that there is a one size fits all. I work particularly with women in perimenopause and menopause. I'm a North American menopause certified practitioner, which I can speak to a little bit more if it's of interest. But
we're going to go
increasingly
there.
what I've learned about in working with women at middle age, and once again, the point of me getting that designation was that I wanted to be well informed about the evidence-based treatment, even if I don't have access to it as a naturopathic doctor, because legally I can only prescribe certain things. I still need to know and be able to have these conversations to really inform women. And I think that's really important. And what I will say is that unfortunately, I think that magic pill or the one size fits all, that makes for splashier social media or splashier headlines, but it's not how it works. I think nuance doesn't sell as well, but I'm a big believer that what I do, there's a ton of nuance, and I experience it every day in the conversations that I have. And I hope that I'm helping people think that, like, if anything, you should look for people that speak to that there's nuance and things should be personalized and really thoughtful.
That's actually a really good point. And you and I have obviously, like, we're friends. So on weekends and stuff, we talk about a lot of different things. And I've shared my IVF journey a little bit on this podcast. And so sometimes I'm telling you stuff about that. And it's funny. And I think you've always mentioned to me, like, well, as long as you feel comfortable with the doctor you're with, right? Or the people who are helping you, the people on your team. And that team doesn't just have to be one person. If you surround yourself with people who believe in the same things as you do, who you feel like you're heard, you feel like they're listening to what's important to you. And I hear that a lot also with like midwives and things like that, which I know you've done as well. It's like, I just want my wishes to be heard.
I haven't been a midwife, but I used to work more with pregnant women.
With pregnant women. So, I think that's all really important. I want to take us just back a little bit, because we kind of put the disclaimer out there that obviously today you're not treating anybody through a screen. You don't know anyone's individual situations, and as you just mentioned, it's so personalized. But I do want to go back into why you even got into this field in the first place, because we knew each other. I believe you were taking arts and science as an undergraduate degree, if I'm not mistaken.
Yeah, and just a very general.
Yeah. So why naturopathic medicine for you?
I think there was always part of me that just had an interest in healthcare. Like, I feel like I was called to be of service, I guess, if you want to put it that way, or work with people on that level, right? Like having conversations, having some sort of therapeutic relationship. And then I saw a naturopathic doctor in Collingwood, where my family lived at the time. And I was really inspired by the interaction that I saw take place. It was different to me. Like, I didn't grow up, right, being exposed to it. It wasn't until I was in late university that I had a personal experience. And then I landed in the office, and it was just such a different interaction, and that's what really inspired me.
So kind of like opened your eyes, and it's like you were
going
down
the
a
way
path.
They had conversations and the time that they took, and it felt great.
How long was the schooling?
4 years. 4 years, yeah.
So 4 years your undergraduate degree, and then
yeah.
another 4 years, and then obviously you're continuing your education
yeah.
now. So it's
like the basic naturopathic medical program is not too dissimilar to medical school. It's about the same time. We don't have the same ability to go into like residencies or specialties, unfortunately, but
maybe that'll
it's
change
4
in
years,
time.
and then you have to write sets of board exams, licensing exams. As I say, we're a regulated profession, so we have a college, just like medical doctors do. It's not dissimilar. So we have to meet the same sort of standards.
I'm interested because I feel like this has changed over time. I hope it's changed, certainly since you've been in the industry. Because a lot of times, like, seeing a naturopathic doctor was not covered by a lot of people's benefits. Am I wrong for saying that? And has that changed?
No, but I would say in the last, since I've been practicing, a lot of people, if you have benefits through your employer, or maybe through a family member or a spouse, you'll have benefits for naturopathic medicine.
Oh, that's good. So the average person has access to someone like yourself.
Yeah, I realize that we're a fee for service, like you pay privately for us, but a lot of people will have benefits through their employer.
Well, what's kind of the average person who comes to see you? Like, when I think of a doctor, you think of maybe like your yearly, I don't even think they do yearly physicals anymore, but like you think of, or just simply going when you're like, I have a boo-boo, something's hurting. Is that the same reason why most people see you, or is it more people come to you for preventative reasons?
Some people come to see me to be proactive and just to sort of, they'll say like, I just want to make sure I'm sort of doing everything right, or just want to check in, but for the most part, as I say, I specialize, like really the only thing I see in practice now is perimenopause and menopause, which includes a wide age range because women can enter into perimenopause in their 30s.
Fun.
And so it takes us from women in their 30s upwards of 60.
Okay.
The age of 60.
So it's usually someone's feeling something and then they like kind of
usually
reach
women
out to...
have a grievance or
Okay.
they're feeling less than themselves. And that's what's landing in front of me. So there's very strong commonalities as to what I see.
Mm-hmm.
And I don't want to make the point that you should assume that perimenopause and menopause is a total shit show and you're fated to feel terrible. I mean, I wouldn't have a job if everyone felt great and was sailing through it. But that's disproportionately, that's what I'm seeing, right?
Okay.
So I work with women that are coming to me at a time where things are getting a bit rocky and they're feeling a number of different experiences, and it can be really disruptive to the quality of their life.
Okay,
So,
we're gonna go in depth on this topic, but just before we
Sorry
get
if
there,
I'm
no, just
jumping
before
the
I
gun,
want to
so to
know
speak.
why. Like, and this is interesting. I don't even think I asked you this. Like, obviously, naturopathic medicine isn't female only, women only.
No,
Why
but
did
I
you
am.
go down that path? Like, is it just because of, like, again, your own personal experiences and you felt like, or was there something
honestly,
specific?
it just landed in front of me. As I say, I've been in practice for over 10 years, and I loved working with kids at one point when I was fresh out of school. Then I was interested in pregnancy and that, but inevitably what always did land in front of me was women at midlife and women with concerns about, I think I feel this way because of my hormones, right? And asking that question. So it's just unavoidable. And I'm a woman, so I take personal interest in it. I live with my own experiences as someone with a menstrual cycle and
Right.
ovaries in their body. And so I think it's just both those things, that it just continued to land in front of me, and I just increasingly developed like a fire or a bee in my bonnet, so to speak, that I was like, why do so many women feel like absolute, like
Horse
they just
shit
feel
all
like they're being left behind,
right.
and they're not having the conversations they want to have with maybe their, who's on their healthcare team already, or they've been feeling a bit dismissed, right? Or been told it's just because you're a woman and this is your age and
Live with it.
you're just
Well,
meant
this
to
is
endure
interesting.
it.
This is interesting because oftentimes, like my show, throughout our guests, I've had a lot of working career-oriented women, like many of them mothers and some not, and all at different stages. But there was, for the most part, an underlying hustle to them, which is why they had part of the reason why they had such interesting stories. But the reason why I really wanted to have you on, because I think my guests really resonate with those types of women. But here's the thing, we're all going to work. We're trying to make it in a man's world. If that's your belief. I'm not even saying that I believe that, but we're out there trying to do our thing. We're trying to feel equal. We're trying to grind and grow up the corporate ladder. We're trying to start our own businesses while we also have kids, and we're really trying to do it all. And unfortunately, there's this thing that happens to us every single month that puts a bit of a damper on our ability to do that at the extreme amount that I think we want to. At least for me, I have, it's funny when I was thinking about what would I talk to you about and what matters to me. For me, it's I just don't have an option not to show up to work.
Yeah.
I own my own business,
Yeah.
which is a side hustle. I also do real estate. Clients don't really care about your monthly cycle so much as they're this is when the real estate's happening. There's really no time to rest. And so I just have learned to kind of just deal with it and muster through. But that's not to say it's been easy. And it's not to say I don't have sympathy for other women who obviously some have much harder times with their monthly cycle as I do. But I really want to kind of get into, maybe if we can talk about period symptoms and stuff first, because I feel like that's the majority of my audience. But I also suspect that, us all being women, we're all at some point going to hit the lovely menopause. And maybe some of us are in it.
You're guaranteed to.
Right.
The interesting comparison is often that pregnancy gets a lot more press. And I'm not saying it shouldn't, but not every person with ovaries will experience pregnancy. But every person that has ovaries, if they live long enough, will experience menopause.
So I always
and
laugh.
it's
I'm
not
like,
treated at
as
all
soon as
the
we
same.
figured the periods shit out, then we go right into menopause. You know what I mean?
Yeah,
and we're like,
probably.
shit. Like
by the time you're 45, and I don't know. Yeah. No, I think I think you're bringing up something that will resonate a lot. Like, you know, for anybody listening with ovaries and has a menstrual cycle. And I talk to women all the time too that like they can't. I don't think we should be setting a precedent for like. There's a combination of like having more awareness, right? And understanding the nature of that cycle that you're meant to have, and actually like arguably what are the benefits of it, right? Beyond just reproduction. Meeting it in a place where it's like, okay, yeah, you can't change your day to day and you have to just show up more on a 24-hour clock, even though your body doesn't work like that as a person with ovaries or a woman. I think, but I do think, I wonder if like there's room for you to say like, have you recognized that at a time in your cycle, it might not be the best time to engage in the biggest public speaking event of your life, right?
Yeah.
But once again, all power to you. And
I'm
like,
laughing because
you're
I
amazing
for sure
if you've done that.
I've for sure had business meetings that I would have wanted to go different ways, but because of, I'm sure, where my hormones were at, like it did not go the way I wanted. And I'm like, what the fuck happened? And you know, you kind of go home and because I don't really change my life around it, you know, you do find yourself in these situations where you're like, had I given my cycle a little bit more respect, maybe I could have moved the meeting. Maybe I could have done something to not put myself in a situation that might, you know, render itself the way it has, right? Like,
well, I'm sure it was ultimately okay, but maybe you didn't feel great walking out of it, right? And I'll tell you the why behind it. I kind of thought before, knowing that you might ask me this, I have a laminated like textbook picture of a menstrual cycle, and I show it and I share my screen all the time because a lot of women haven't actually even seen a graphical representation of the menstrual cycle.
Okay.
Like, have you ever seen
no,
that?
I guess not. No.
So what you need to
have to
understand
send it
about
to
having
me
a menstrual cycle is that you are under the governance of a coordination of hormones between your brain and your ovaries, and the result in the rest of your body. And that those changes, like envision a roller coaster where like it climbs up like this and then it drops like this and then it goes back up and then it drops again. That's what it looks like on a hormonal level.
And I think the best way to probably understand that and why that's significant is to maybe compare it to, say, a man's hormone.
Well, men don't have
which
that.
is just more
Men's
consistent
testosterone
like this, right?
works on a 24-hour clock, and we have a 24-hour clock.
So we got
like
two
light
clocks.
and dark, but we have a whole other clock that works more
Double the
over
clocks
like
here, folks.
weeks, right? The course of weeks. So, and there's an important reason for that design. But once again, I think there's just historically been a lot of language and rhetoric used to describe it in a way that is not empowering, right? To say that women are crazy at certain times, right? And
I do feel a little crazy though.
right. Well, this is where you're probably, and I would say I'm going to give a tip right now.
Okay,
is that
sure.
if you feel that you are experiencing these hormone rides, the roller coaster, so to speak, track your symptoms and your cycle.
Okay.
Track it against your cycle. So track the timing of your period.
Yeah, so let's say,
if you have a
I
period.
always know that the 5 days leading up to my period, I'm a little more emotional, maybe I'm a little less patient.
So maybe you already know that, but
Yeah.
some women need
They
to
don't know.
track, and
Okay.
there are evidence-based tracking tools to really help you do that.
Like apps and stuff? Like
There are
just doing
apps
it?
that
Okay.
you can use. There's a couple good ones, and then there's actually a pen and paper tool that's actually considered the proper way to actually diagnose
Oh, okay.
PMS or PMDD, which is premenstrual dysphoric disorder, which is essentially like PMS to a much more extreme extent. So women can be really debilitated by mood changes that they experience, irritability, sadness, anxiety, insomnia, which is something I experience now in the week before my period. Women can experience physical changes, breast tenderness, water retention, bloating. Some women get acne that might be triggered by hormone fluctuations. Hot flashes and night sweats can start to happen.
Migraines, I feel like I hear a lot of people.
Yeah,
Headaches.
migraines can be very classically triggered by the drop in estrogen. What you need to know about the premenstrual syndrome thing, or PMS, you can only have PMS if you ovulate. So if you're on birth control, which suppresses ovulation, it's not PMS. I'm not saying it's not real, what you're feeling, but it's not technically PMS because you're not ovulating.
So it's just something else to do with the hormones.
Yeah, or maybe it's life circumstances. I mean, there's a lot of things. This is why tracking, once again, is so important to give you clarity where you can communicate to whoever's on your healthcare team about, I really don't feel myself at this point, and it helps me to be able to see that so that I can speak to what the most effective solution or strategy might be.
I'm laughing. I'm sorry to make this kind of funny, but like I was just thinking as you were talking about it, like being on birth control, and so many of us, right? We go on birth control. Not everyone, but a lot of people, like relatively young, and then you're on it throughout your 20s, and you seem like a pretty normal, like human, and then all of a sudden, you know, tie that man down, go off the birth control, and then it's crazy time, and that just made me laugh. Now, it's obviously not the truth, and I'm not helping with the language that you're talking about, so I need to obviously help on that regard. I just think it's kind of funny that, you know, as soon as like we're ready to have kids is, you know, when you go off of it, and then all of a sudden you start noticing these things, and that's why it's funny. I would have said like I really didn't have anything during my 20s, which is now makes sense because I didn't realize you didn't have PMS if you were on birth control. So that would make sense why in my 30s it kind of started.
Yeah, the technicality is that if you're not ovulating, it's something else, right? Once again, I just think it's important. I think, I don't know why I'm a stickler about language, I guess, in some scenarios, because I ultimately just want women to have more clarity, right? And help. I really think like using language in the right way will help propel forward the best sort of attention and solutions and just getting women what they actually need.
So I know you can't give specifics, but is there kind of certain things that women can do throughout their cycle that can help with PMS that are kind of like evergreen for everybody that helps?
Yeah, they're not going to be the most exciting things. I will say don't underfeed yourself.
Oh, I don't have a problem with that.
I know, but I see a lot of women that I do see are underfueling themselves, right? So whether they're not eating enough protein in a day, that's a big one. They skip meals because they're just too busy, or they eat, you know, scraps of what their kids have or things like that. And it just amounts to a woman that is underfueled. And what I often remind, so women, it's a common concern that women come to me with premenstrual syndrome concerns, whether it's mood, whether it's migraines, whether it's pronounced fatigue, sleep disruption, it doesn't really matter. But what I explain to them is that, you know, sometimes they're hoping that I'm going to pin it on one hormone and be like, that's the fix. It's not. The treatment solutions for this are not about making this hormone this and balancing it with this. They fluctuate. That's what they're meant to do. The solution is more about improving the body and the environment that the hormones are working in. So the hormones are affecting...
So it's not like we're trying to decrease the extreme of the hormones.
No, sometimes that is a solution. For example, women that are offered birth control to treat, you know, a ton of pain with their cycle or maybe really pronounced mood disruption. The birth control pill is actually a treatment strategy because it will take some of the fluctuation out of it. But in a woman who's not, and that can have a place, absolutely, and sometimes I meet with women and maybe we've tried other things first and it's not having enough impact, and I give them the counsel that I think you should explore this other option, you know, with your doctor, and that we'll both follow up with you on it, right, as it relates to how you're doing, right? So sometimes there is a goal to flatten hormones out in some scenarios, in women that have extreme, you know, disruption to their quality of life, and that has an important place. But if we're not talking about that, then once again, often I'll describe to women, like, we have absolutely opportunity to just equip your brain and your body. I'll call it with like resiliency tools so that it rolls with the hormone roller coaster.
I like that, resiliency
in a better way. I call it like hormonal resiliency.
So we want to make sure we're eating enough.
Don't underfuel.
Okay.
Don't skip meals. I would say focus on sleep. So that can be another whole bag there. Like if you need support with sleep, get support with sleep.
Yeah.
Because that's really important. I would say there's certain things like basic blood work that is recommended for women that have cycle-related concerns. Testing vitamin D levels is really important. There's a depth of evidence around vitamin D deficiency, aggravating premenstrual mood changes, physical symptoms, things like that. I always test iron in women because it's a very common deficiency, and it's not the cause, but if it's there, it's just rubbing up on it and probably aggravating
And then
it.
iron's best friends, I think. What are the other two? Folate? Aren't they kind of intertwined
I'll test
a little
B12
bit?
commonly,
B12,
and look for that too. We don't test for every nutrient in the book, but the big three are sort of vitamin D, iron-related testing, and B12. Actually, testing hormone levels is not helpful, and I want to make that point because, as I explained, they fluctuate so much.
Oh.
All we're looking at is that they fluctuate.
You're like, congratulations,
and
you're working properly.
It doesn't change anything about the treatment.
Gotcha.
It doesn't.
Okay.
So there's a place for that if a woman is having a really erratic cycles, or maybe let's say a woman that had a cycle or regular period and then all of a sudden she doesn't, or something else that's uniquely different, right? Then we would test hormones because we need to figure out what's gone off in the brain ovary sort of command center piece. But the most common hormones I check would be thyroid, blood sugar related hormones, and that's it.
And
but
thyroid
testing,
specifically, because I think a lot of women are, what is it?
Hypo is more common.
Hypothyroid is more common, and that can make people feel a little bit sluggish and things like that.
Yeah, the symptoms of hypothyroidism are like you just feel kind of like you're underwater. You feel draggy, you feel tired, you can feel fluid retention, constipation. Your hair can fall out. You feel cold. You sort of.
Why
feel
is that so
intolerant.
common in women?
It is common, and I test for it because I believe we should making sure it's being ruled out. I don't know that I have a really good answer. I've read things. I'm not particularly a specialist there. I have other colleagues who are, but I know there's questions about, there's probably genetics, environmental exposures, maybe really chronic, unrelenting stress that just sort of fatigues the thyroid over time.
Okay. So you testing for these types of deficiencies is an indicator that maybe you can't be as resilient to the hormone fluctuations.
Yeah. Okay. I would include it in that.
Okay,
right?
gotcha.
Yeah.
So most people, when they come to see you, they obviously start there, and then
if they haven't had recent blood work done in the last 6 months, maybe they already have with their doctor. And a lot of women come to me and they were like, "My doctor didn't say boo about my blood work," right?
Yes.
And it might be because everything is normal.
Right, and I'm glad you did this normal, because oftentimes people say, well, it's in the normal range, but how do you know what's specifically normal for you if you haven't gone and gotten blood work over time?
Totally. Sometimes I'm meeting women where they've never had that baseline established with blood work, and so I do that. And sometimes they have it, so I want to get that past information, and then I can show them comparatively if there is something that's even worth comparing, right? Like maybe things like blood sugar control, maybe things like cholesterol, right? Once again, a big evolution in my practice over the year was that I used to do more hormone testing, admittedly. And what I've just learned, and through working with other doctors, is that that's not evidence-based. So anybody who says we'll do a whole fancy slew of hormone tests for your PMS, run.
Right. At least that's what the current, and that's what's so interesting about science, right? Because it changes, it evolves over time. And as doctors, you guys need to be willing to
You have to
unlearn things and say, maybe I was wrong there.
Yeah. Just
and
rethink it,
change.
be critical. As I say,
you're doing it based off of the evidence at the time, the best evidence that you have at the time.
I would say some of these things have never had good evidence, but they sell tests and they sell treatments and they sell programs, right?
Okay.
So I'd be leery of things where there's a connection there. I only just do basic blood work that your doctor would do.
Okay.
Pretty much.
Now, when if something is off in the blood work, is it, what can people do? Is it usually food related? Is that the quick fix? Is it supplementation?
Very often it's both, a little bit of both. I like to be really targeted with supplements. So I like to think of is blood work going to tell me something I don't already know about this person and actually influence the treatment decision-making strategy, right? For example, I won't just say, Laura, you better take iron because it's very common, but I should see it in your blood work. Is it actually required based on your blood work? Same thing with vitamin D. A lot of people are going to be deficient, and it's very common that I'll be like, you're quite deficient. even
Especially
in the summer.
here in Canada, I feel like, and we all work in offices and we're all inside.
Yeah,
and no
it's
one
very
goes out.
common, and that once again helps dictate how much you should take, right? But yeah, it's both often, right? So once again, the really common tests are things like, I really want women to understand their blood sugar control, because that's going to be something that changes as you get older, right? So if you don't have a baseline now, right, you need to get it at some point. And I think often at midlife, women, I will say, you have an opportunity to get to know that better and be empowered that through nutrition and lifestyle and maybe some supplementation and maybe medication in some cases, you can be doing things that are ultimately best for your health and your longevity.
It kind of sounds like specifically when we're talking about PMS, like you don't have to live the way necessarily that you're living, right? There's options.
Don't settle for it.
Don't settle. And I think so many women do that too, right? It's just, you're like, okay, it is what it is.
I mean, and I'm still not immune from sort of making light of sort of being hormonal, right? Or I have PMS too. Like, I can relate when women are like, I feel like a psycho, right? Like, and everybody around me bothers me for no reason, right? Like,
my husband's blinking is pissing me right off. Yeah.
We make light of it, but you don't have to settle for it shouldn't affect your day to day. If it's affecting how you show up in your life consistently and you don't like it, don't settle for it.
It doesn't have to be that way. Any food related tips that for people with PMS, like avoid carbs, or I don't know, avoid sugar, nothing.
Don't avoid carbs.
Don't
eat carbs. Eat the carbs.
You heard it here, people, and that is why I eat carbs.
There's actually research telling us that carbohydrate restriction will aggravate PMS. Your brain, that your estrogen has decelerated on you, and your brain is like, where'd it go? And it will swing back up. And this is where, once again, PMS classically is like, I feel terrible here. And then I'm like,
yes.
Right?
You feel like you're on top of the world.
And that's because your estrogen is swinging back up and your brain loves it.
So nothing really from a nutrition perspective we can do to try to
I hesitate to say there isn't a one size fits all. I think the biggest thing I can tell you is don't underfeed yourself. Don't restrict if you don't have a really good reason for it. Maybe you have a digestive condition that underpins that, right? But no, as I say, I think the more that you fuel your body well, and you just it'll sound like the basics of self-care, but that really is what supports the resiliency of your brain and your body when these things are going to change on you.
It's kind of like, eating a well-rounded diet, getting enough sleep, like the things that every single human being hears, that's going to help you in these situations.
Now, once again, sometimes that's not enough, and then there are some evidence-based herbal medicines that can be helpful, correcting certain nutritional deficiencies. And then for some women, if that's not enough, we should be having a conversation about conventional medication, its place, maybe antidepressants. There's good research saying antidepressants will treat PMS very effectively for some women.
Oh, okay.
So we shouldn't be saying it's bad or it means you're weaker or something.
No, I have this question because I feel like a lot of people I know, both men and women, obviously you use medication when you have to, but there still is, a lot of people who want to feel like they're doing something natural for themselves. I mean, we're all kind of hypocrites because there's so many things in our lives that we do that are completely not natural, but I don't want to take prescribed medicine for things. And I feel like obviously a lot of people come to you for those things. Any thoughts on that? Do you always try to solve the problem first or help with the issue first through non-medicated means, like a tea or? I know I'm being very broad.
No, because I think sometimes it can actually frankly do harm, maybe to say to someone who is taking medication for a good reason, like maybe for their mood because they have moderate to severe depression, right? Mm-hmm. And they still might be landing in front of me because they still don't feel totally well, right? And they might have this idea that I'm going to have these exciting alternatives.
You're going to concoct some tea and
it's just say oh yeah, I do, and let's take you off that. Maybe someone with high blood pressure, right, and wants to come off their that's great, right? I'll listen and respect that, but be very honest about setting expectations and goals there.
Okay.
I'm not anti-medication at all.
Yeah, I just feel like people, when they think of the type of field that you're in, they just think I'm going to be off all the drugs and I'm only going to do everything.
No, as I say, it's not an either or. I have lots of patients that take quite a few medications, and then I have other patients that take none. And I think I'm intrigued by that too. Like, I think I've had to unlearn some things there, but I'd even put to you, like, where do you feel like that bias is, or that belief that like medication means something about you, or your need to take it?
I think for me personally, like, it probably just goes back to me as a kid. Like, I just always felt like whatever the pain or the thing that you're suffering from, like, you almost go through it. Like, I've just always kind of been like that person. Like, I very rarely take even like pain medication for anything. And that's not to say I don't take medication when I need to, and the doctor's like, no, you need to take this. Like, I'll take medication. I just find like there's just certain meds that I really just don't take. And everyone's like, Laura, you have a headache, take the freaking Advil. And I'm like, no. Because like, I guess to me, it says something about me and my resilience, or my, like, if I can get through this, it kind of is another notch on the belt of like me building up to being a little bit stronger. But that doesn't make any sense.
No, I totally respect it. I know. I think there's some of that in, like, oh no, like
you almost feel proud.
Try not to take that.
Like, you feel proud for not doing it, but we shouldn't.
I think maybe I hold on to it more personally, but I have an easy time with patients being like, take the Advil for your period cramps, like, and take it 3 days before your period starts, because you know they're bad, and it works better when you do that, right?
Ahead of time.
Oh, yeah, you got to take it ahead of time. Got to get ahead of the curve.
I'm not taking it ahead of time, not taking it during. I just suffer the whole way through.
And I'm sorry, I'm just going to make the comment that there's a quick and fast assumption that natural tools or supplements are just automatically safer. Mm-hmm. They're not. Everything has benefits and risks. And it's my job to hash out, like, are there risks? There can be side effects with some herbs. There can be interactions, like everything. It's not immune from that. So don't equate natural with safe.
The biggest difference between you and, say, a traditional medical doctor is that, like, if I go to see my doctor, they probably won't even consider the natural remedies.
Some of them do.
Is that what the difference?
I know that some of them do. I can't speak. Some medical doctors are absolutely, they'll refer to naturopathic doctors because they know that we have more time and just a different skill set to address things like IBS, for example, right? It's not maybe totally commonplace, but I think you can't, like, different doctors have different knowledge, right?
Right, and they all have different practices. And like, just like you said, like, you have different practices from other NDs as well. So even within the field, like, it's, again, I guess it goes to the point, like, you have to find people on your team that you just resonate with.
Yeah, you gotta.
And like, so if you go to one naturopathic doctor and you don't like it, that doesn't mean that they all suck and this is awful. I say that about therapists too, right? Like, you go to one therapist, they don't jive with you, but they might be it just wasn't a fit. So I'm gonna move us along to a topic I don't really want to talk about, because in my mind, this isn't gonna happen until like I'm 100. But I get the feeling it's around the corner.
I know where you're going.
So menopause. This is, you'd mentioned quickly, like, something that some women start to deal with in their 30s. I'm pushing my late 30s here, so tick-tock.
That's a rarity. When women go through menopause before the age of 40, it's actually called something different. It's called primary ovarian insufficiency. So it's actually a different diagnosis, and it's considered more of a true hormone deficiency for a while, because you're losing estrogen so much earlier than you typically would. The average age of menopause is 51 in this country.
Okay, great.
So most perimenopause is the lead up to menopause.
Yeah.
And think
menopause
of it as
is actually when it's
just
done.
A day that
it's
marks,
a day, like
it's an anniversary of where you've gone a year without a bleed.
Because people always say, I'm going through menopause, but you're not going through menopause, you're in perimenopause.
You've reached it.
That's
a colleague of mine and a really important advocate for this time of life would say you've reached it. And then anywhere after that year where you've gone without a period, you're post-menopause. So you're going to live a third of your life, if not more, in post-menopause.
Right.
Right?
So you actually live probably, like, depending, most people get their periods, like, early teens, I suppose, and you have it up until 50, and then, you're right. So it's a big part of your life. So this is very important, because I get the feeling we can set ourselves up for, again, having more resilience going into it.
Yes.
Can you explain why, let's go back to basics here. Like, why does menopause happen? What's going on in the body?
I'd like to think it was nature's way of being like, women don't need to have a period their whole damn life.
Oh, thank you. Thank you,
That's
Mother
a pro,
Nature. Yeah.
ladies. You're not going to have your period forever if you want to look at it that
It's funny,
way.
we hate it. We hate our periods until we don't have them anymore. We miss them.
Yeah, I say that about estrogen too, which often language about estrogen is that like estrogen is what makes you feel bloated and it makes you feel crazy. And like, I always say, I'm like, you'll miss her when she's gone. She's not the enemy. And your period's not either, although a lot of women unfortunately have things going on that make it really disruptive to their day-to-day and their quality of life. So yeah, I think it's just nature's design that women were meant to reproduce for so long.
And then what is it? A change in estrogen?
Yeah, so
really
basically menopause is where, when you have a menstrual cycle, once again, it's dictated by the hormonal activity in your ovaries, your brain and your ovaries together. Menopause means you reach this point where your ovaries are like, I'm done. They hang up the close sign and they don't produce near the same amount of estrogen or progesterone that they did when you were cycling or in your reproductive years. Mm-hmm. So you reach a point where the ovaries, they only have a finite number of follicles or eggs in them. Mm-hmm. So everybody's going downhill as they age. And when you reach the point where they're like, now I'm really at the end of
So it's not even to say that you're out of eggs. It's just that the hormone
pretty well.
Or is it like,
well, the
like
eggs
this
are,
is the last
the
egg.
eggs in the ovary are what produce the hormone. So estrogen doesn't just come out of the ether. It's produced by the follicles in large part in the ovaries. And they're declining as you get older, as once again, we're born with a finite amount. Mm-hmm. We can't make more of them magically. So once again, that influences why some women will go through it earlier, right?
Right, so they were just maybe born with less or over
Or maybe
time.
they've had something that affected it.
Right.
So some women go through menopause earlier because it's common in women that have chemo for cancer. So their ovaries will be affected by that or basically shut off by that treatment. You know, some women have ovaries removed for other reasons, maybe for cancer risk mitigation. Mm-hmm. But once again, the natural average age of menopause is 51. It just means that you're at that time where it's natural that your body is like, that's the end of my reproductive life. We're going to let that go. And now I'm going to adjust.
Move on.
To being in a lower hormone state.
Okay, so let's talk about what happens first. What should people be looking for, or what are common questions that you get ahead of menopause? Like, is there something that we should be doing to like set ourselves up for the most successful transition?
I get a lot of women just asking me, once again, like maybe in their 30s or 40s, and they're having changes to their mood or their sleep or their cycle experience, and they're coming to me saying, I think it's perimenopause. Am I right? Is it perimenopause? Right? So it's a good question to ask because they're having changes that they're picking up on. It might be disruptive to them. They might really be uncomfortable with it. And I'm there to talk through it, make sure that I'm thinking about the other things that influence their health and their well-being. But I think women can be dismissed at this time and say, you're too young, right?
Okay.
We shouldn't be telling women that. We should be, if you have knowledge and skills, you should be able to ask the right questions and get the information that helps you make a proper assessment, right? Perimenopause happens on an average for 7 to 8 years. Oh. So it doesn't happen overnight. It's like kind of arguably we might call it like puberty in reverse, which doesn't happen overnight, right? As much as you might feel it. I can't really remember that time very well. It's very foggy. But it's a continuum and it happens over quite a stretch of time. And some women are not affected by it. So they might be in perimenopause, but they might not really know it, right?
What are some of the typical things to suggest that someone is in perimenopause?
So really by definition, you're starting to experience period length variation. That's like the textbook definition. So
longer or shorter?
Longer or shorter by an interval of 7 days.
So like typically. Double your period length almost?
Yeah, meaning the time between your period is changing.
Okay.
But it can be possible that even before maybe you have your period changes by 2 or 3 days, right? In between. Once again, women can feel like PMS is like supercharged, right? Or they're like, I've never felt this PMS-y, or it feels longer, right?
So we have new onset PMS to look forward to.
Possibly. They have new onset insomnia. They have new onset depression or anxiety or like a mood disruption that can be quite common. body composition changes, unfortunately.
And that's usually it's oftentimes what women say, like, oh, like now all of a sudden I'm gaining weight more around my midsection and things like that,
it's
right?
not uncommon.
Yeah.
Sex drive changes.
Lowers, I presume, or?
What's that?
It lowers?
That's the 90% of women in my practice will report that, probably.
Okay.
And then there can be physical changes. So women can experience changes to their skin, heart palpitations, digestive changes. Like, it can affect the whole body. And the important thing, a good practitioner will have it on their radar that we don't want to quickly be like, oh, because you're 45, we can blame everything on perimenopause. Once again, the very strong likelihood is that you're in it because it lasts for as long as it lasts, and the average age of menopause is 51.
Right.
But you still deserve to have someone make sure that we're looking out for other things that might be contributing. And it's a normal transition to go through. And I think when we approach it with just helping women be more aware, giving them the space to at least bring their concerns up and have them be validated and not just dismissed as like, it's because you're a mom or it's because of your age or whatever, then we can start to talk about specific strategies. And they can be different, and they can include, once again, certain nutritional strategies. Sometimes some of the most important things I do is like refer women out for when they need more mental health support, right? Or they need pelvic floor physio support.
To go back to the mental health component, do you feel like that is because of the hormones on the brain, or is it because just what's happening is like an upsetting time and it's like women struggle with it?
I think it can be both.
Okay.
I think, would you agree? I think we have like generally aging is not celebrated.
Yes.
Like we have a hard time with the idea of aging.
Yeah.
So it's hard to unlearn that. And I think once again, if a woman's body is changing, that's hard.
Right. It kind of feels like a very final time almost in a woman's life. Like.
And I'd love to try to, I'm not there yet, but I'm a aging woman, and I'd really like to think that we can do better than what we're doing already, and that we should celebrate the opportunity to age, and that you're not done and dried up and over, right?
Like,
I know.
And you're right.
I'm not the first person that said that.
No,
right?
I know,
but like,
for sure.
There's a lot of negative association with this. It's not, once again, like, and I'm not saying we shouldn't, but pregnancy is paid so much more attention, and I wonder if it's just, like, what do we associate with that that's more important than menopause? Right?
That's such a good point. It's interesting because I know you and I were watching, I can't remember what movie, over like a year ago, and there was an older woman main character.
It's oh gosh, good luck to you, Leo Grande, or something like that. It's Emma Thompson. Watch it.
Watch that
so
movie.
Good.
Like talk about celebrating getting
Aging.
older and aging, and I think it's such an important conversation. And what I do with being on camera and stuff, I actually have a lot of conversations with people about like how they look, and they're like, I look old now. And so I am in a lot of conversations with people, and some women will say, well, I don't want to put myself on camera because I think I look old, right? And I try to help build them up to say like, well, you look how you look. You can't change that. But if you want other things in life, we're going to have to get over that fear. But like also like setting that precedent maybe for your children or for your future self to say like, what I say about myself is very, very important. And it's not to say that I've nailed this one, but I am taking a lot more time in my life to like look at myself in the mirror and like appreciate the woman that I am now, because I'm not going to look as good as I do now in the future. So let's enjoy it. But more important than that, it's think of what else we've learned. Like when I compare myself to my 20-year-old self, I'm like, thank fucking God, I'm 38. And I can only imagine at 51 what I'll know. My mother's birthday is today. She just turned 65. And I asked her,
Tina.
I know. I asked her on the phone, I was like, what do you feel you've learned? Like in the last year, let's say. And we've had a lot of family health issues lately, but with a couple people. And she said, just celebrating the now. She said, seize the day. And I said, well, what do you mean by that? Like, you're going to go like jump out of a plane, like that kind of seize the day? And she's like, no, just being content in the moment, being content where you are. And I think a lot of that, the mental aspect of aging is like being content at that age that you're at and just like respecting it and loving yourself for it.
I think as I get older, I just know myself better. I've been able, I've gone through a bit of burnout, and it's like shaped where I've landed in my how I practice and do my work, and I'm nothing but grateful for that. And I think that's what comes with aging and getting older, is that you get more settled in yourself and more confident, and
that's always what you hear people say, like, oh, like women when they're approaching 40 or like in their 40s, it's always like, oh, like I just feel way more confident now. Like you kind of shed that skin of like worrying about what everyone thinks. I think motherhood does that for a lot of people, because people just realize like I'm going to make decisions for my family and to help with everyone else. But I think it happens to everybody, and it's I think it should be celebrated more. I want to go to a couple questions, but before I do that, is there anything specifically that you want to share, either like for when the transition has happened and people are in menopause, that they can do to help, ease some things for themselves? Again, like I know that you can't. It's not like this is what you should do, but is it supplementation again? Is it diet? Is it?
That's going to vary. I think what I want women to know is whatever you're experiencing that is you're hung up on, whether it is a body composition change, a mood change, that your sleep is nowhere near what it used to be, that your sex drive is in the tank, that we haven't even talked about the changes to the vulva and vagina that can happen, that are very common, but they happen, and a lot of women are too afraid to bring it up.
Okay, to even someone like yourself? Or just to like
I
doctors
ask about it. It's not the first thing I ask.
What's the question? What's the question? Like, how's your vagina doing?
Well, are you experiencing pain with sexual intercourse?
Okay.
With vaginal penetration? Are you experiencing any new dryness, irritation, persistent itching, discomfort? Those can be common things. There's urinary changes that can happen, so new incontinence, urge frequency, peeing more at night, UTIs can be common post-menopause. It's all due to the drop of estrogen that stays. The changes to the pelvic area and the tissue there, they don't get better with time. Things like hot flashes, which is the most maybe arguably famous symptom of menopause, they get better often on their own. There are some groups of women that will have them more persistently, but a lot of the time I'll hear it from women that.
And is that usually happening during perimenopause or menopause?
Like it can. Once again, it's a continuum. So they can start in perimenopause. Maybe sometimes at first it just happens at a certain time in the cycle when your own estrogen is low, and then it becomes more random and feels all the time. They're probably more likely to happen in late perimenopause, meaning closer to when your periods are going to stop, and in the first couple of years after. But once again, it can vary on either side. But basically, you need to bring your concerns to a practitioner. What I'd encourage is look for a North American Menopause certified practitioner, because we've put the time in to being trained and educated about the options for care and treatment. And North American Menopause certified practitioners, I'm one of a growing handful of naturopathic doctors that have the designation, but mostly it's medical doctors and obstetricians. Okay. And so it's not discriminating to the healthcare provider, but that you basically just have to study, write an exam, and then you maintain, continuing education. But I did it because I was encouraged by the doctor I work with now, who was one of the first naturopathic doctors to get the designation, because I felt like more women deserve to have healthcare providers that are up to date on the information. They're trying to create sort of like a standard of care or practice guidelines, because for a long time, we don't get education in medical school about menopause. We don't.
Really?
So
like not even a day? Class?
Very little. And in medical school, and even in naturopathic medical school, there was not much. So how can you expect your doctor, right? Really, it's on them ultimately, right?
Yeah.
So they have to have put in time and extra resources to understanding it. So once again, you can go to the North American Menopause Society and search by area all the practitioners that would be listed as that designation. It could be a medical doctor, it could be a naturopathic doctor, maybe a specialist. But I would say the first step is to find someone that is going to take your concerns seriously and talk through it. And only then can you start to explore the plethora of options that are available to women. Right. You don't have to settle for it. We have lots of great tools.
Wow, I didn't know that. That's very interesting. And it sounds like, just to kind of tie it all together, obviously you don't have to suffer in PMS and with menopause, but at the same time, I think a big part of probably what you teach is just the coming to grips with the changes, because some things we can't prevent, right?
No.
Body composition, saying like, well, I don't want to be gaining weight on my stomach. We can't really do anything about that, I presume.
Yeah, I think I am of the belief that bodies change. They're not meant to stay the same. And often I'll tell women, like, our goal here is not to make you 25 again, reproductively speaking.
Okay.
I don't have tools to do that,
Yes.
right? And if somebody says they do, run away.
Right.
But once again, I have tools, and I think if you are working with someone that's able to have a good, in-depth conversation and meet you where you're at and give you all the options that exist for you, then you can make choices about where you want to put your energy. You know, that looks different for every woman, but yeah.
Okay.
There's just lots of options.
I'm putting you a little bit in the hot seat, because I did do a little post on Instagram about that I was having you. It's funny. I do posts where I ask people to give me their questions and comments and stuff. This was probably, I'm thinking in my history bank, the most feedback that I've gotten on a post, the most questions.
Okay.
I only picked a couple that I thought might not have been covered in our conversation today. So obviously, there's a lot of questions out there. There's a lot of people who don't have the education. I'm sitting here as a woman who does experience a lot of these things, and I don't know the correct terminology. I don't know the answers.
Yeah, and you're not alone with
that. You know
that.
what I mean? Like, and you are almost in a way scared to look dumb. Because it's like, holy shit, I've had my period my whole life and I don't even know like the right word. I don't even know why it's happening. Or like, you know, you don't know what you don't know. And I think that's where a lot of women struggle.
Yeah.
And so I'm glad that they reached out, because hopefully they felt like today would be, you know, a safe place for them to get maybe some guidance.
Yeah.
Okay. So we touched on some, but one here. If someone is allergic to synthetic progesterone, how else would they treat menopause? So obviously this is someone who's gone to a medical doctor, because that's where you would get prescribed progesterone.
Okay, so I'm assuming I don't know the whole story, but menopause hormone therapy, or what you might be more familiar with, HRT, or hormone replacement therapy. We call it now menopause hormone therapy, to be clear, because there's other times we give women hormones, but not necessarily for treatment of menopause associated symptoms.
And this is is this something that people are putting on their arms, or is it like a cream?
There's transdermal, there's oral routes.
Okay.
And then, so synthetic progesterone, those are technically called progestins or progestogens. Progestins are the compounds that mimic progesterone, but they're not exactly the same as our body's own progesterone, which is produced in our ovaries when we're reproductive. Progestins, or these synthetic hormones, are often used to treat heavy bleeding concerns, maybe a lot of pain with cycles. The IUD, the Mirena IUD, is a progestin-containing device. And then there are oral forms of it as well. Those are probably the two most common, is either oral, which might be found in birth control pills, because birth control pills are typically a combination of estradiol and progestin component. In menopause hormone therapy, so let's say I'm treating a woman with hot flashes, and hormone therapy is a first line indicated, works fabulously when the benefits outweigh the risks to treat that. If a woman has a uterus in her body, she must take a progestin or progesterone to accompany estrogen. Now, there can be some side effects to synthetic progestins. That woman is going to have to hash out, I don't know why she's taking it to begin with.
Right.
So I need
or maybe
to know,
she's not taking it anymore because she figured out she was allergic, but now it's like, what's the treatment if you can't take
that? Really, once again, depends. I don't know what the concern is, but depending on that, it would be like, well, what is this about? Do we need it because we want to give you estrogen and we need to have something to accompany that?
Gotcha.
The point of the progestin there is that giving estrogen alone to women is too stimulating to the uterus if you have a uterus in your body.
Okay,
so we can't give estrogen alone safely, but if you don't have a uterus, you don't need the progestin component necessarily.
Got it. It's interesting. We talk so much about estrogen, right, women, but progesterone is just right there as important. Why do you think that is? Like, why don't we talk about it and its impact on the body as much? Like, everyone always, I think it may be because people think estrogen is the thing that controls their behavior. And so it's like, oh, she's crazy because of the estrogen.
They both do.
Yeah, I know. So I don't know why. Anyways, just a thought.
Yeah.
Okay.
They're both important.
Second question, is there a cure for endometriosis? Maybe you can touch on what endometriosis is.
Endometriosis is a chronic inflammatory condition that is where endometrial tissue, which is the inner part of the uterine lining, grows outside of the uterus, potentially. It is, once again, it's really the keynote is it's a chronic inflammatory condition where this hormonally responsive tissue will land maybe in the bowel or just a little outside the uterus or in the pelvic cavity somewhere generally.
And it causes pain, I presume? Or?
So what happens is when your hormones fluctuate and cycle, if you're doing that, that tissue unfortunately will respond to it. So it can prompt pain. Other symptoms of inflammation, like digestive symptoms, can be really common in women with endometriosis. They often are told that they have IBS.
Right.
So they coexist very strongly. Really classically, it's like pain that is aggravated with the menstrual cycle, but sometimes persists outside of when women are actually bleeding too.
What are some things people can do?
There's really wonderful conventional medication that should be tabled for women. I think one of the biggest challenges with endometriosis is sometimes that women, we know there's a huge delay to proper diagnosis. Mm-hmm. So on average, it takes 10 plus years to properly diagnose.
No way.
And it's thought that more
that
than
would be someone continuously
1 in
going
10
back.
women have endometriosis.
Interesting.
It's been notoriously something that's not been well researched. That pain, we've normalized menstrual pain so much that I'm always like any woman that comes to me and tells me that she's debilitated by menstrual pain, and that's not new, I should be questioning that she might have endometriosis, right?
Interesting.
But doctors are, it's just period pain, right?
Right, get over it.
That maybe doesn't respond to taking Advil or naproxen or whatever it is.
Okay.
Unfortunately,
so not really a cure.
there's not a cure for it. Unfortunately, once again, there's probably some genetics involved. It's kind of complex, and I won't go into why it's thought it happens, but really the keynote is that it's thought to be a chronic inflammatory condition that is exacerbated by hormones. It's not caused by hormones.
Okay.
So the solutions sometimes include blocking hormones so that you don't respond to them. My toolbox can include certain nutraceuticals that help tamp down inflammation. Interestingly, melatonin is one of the better studied things for endometriosis. Once again, I hesitate to get into specifics because you should hash them out with whoever you're working with.
I'll send her your way.
There's always benefits and risks.
Right.
But yeah.
Okay. And lastly, two things. Foods to avoid with fibroids. Maybe you can touch on what fibroids are first, or is this down your level of
fibroids
expertise?
are benign growths within the uterus that often cause heavy bleeding or irregular bleeding patterns. It's not unusual that women incidentally, maybe just because they have an ultrasound for whatever reason, maybe because they're bleeding more heavily or for longer, and then it's, you have some fibroids. They just seem to happen more from the age of 40 and up. They'll be assessed by an ultrasound, a transvaginal ultrasound. Sometimes you can actually feel them if they're big enough.
Oh.
Once again, most commonly they cause heavy disruptive bleeding, unfortunately. And once again, they're not caused by hormones, but they respond to hormones.
Okay, so this is probably not a food-related question so much.
No, I wouldn't say there's a depth of evidence about these foods have been linked to it. And I know you can go on Dr. Google and there will be people telling you that you need to detox your estrogen
right,
and not eat any meat. And I'd be hesitant to follow. I don't know. I think everybody has to land
like
on what
endometriosis
fits for them.
as well, where it's like if it's based on the hormones, then maybe we can do something to flatten them or lessen the extreme. Of it.
Yes, but typically that's done with conventional means.
Got you. Right.
Yeah.
Are there ways to really intensely change your hormones not using medicines?
I would argue that, if you don't get enough sleep and you're chronically deprived, if you really
I guess I was thinking
yourself,
something that you feed yourself, yeah. But
No.
a specific food or...
No.
I
think with food, I'm going to make the statement that I think there's this idea, maybe naturopathic doctors or nutritionists, that the wellness community, I'll say in general, or the wellness industry, maybe I should put it, which I'd like to think that I'm not part of, but They overestimate the power of food. Conventional medicine underestimates it. I think there's a middle ground there. So I don't tout food that like the top 5 foods that fix this, right?
Like don't eat shrimp or don't like
I shy away from that, right?
Okay.
Or that these are power foods and they'll magically fix everything up.
Yeah, it's funny just being
so much
just
more
knowing you and being your friend. Like you've never really said like any one thing is bad or any one thing is good, right?
I love food.
It's very much. I know you and I eat a lot of food together.
We have that in common.
But you're very careful with what you say because oftentimes it's people just want the source, they want to pinpoint what it is, and they want to remove it or add it. And then they're perfect. Unfortunately, there's like all this work involved, right? It's like overall health and overall.
Yeah. And I see a lot of damage in the way that can maybe build a relationship with food that becomes obsessive. I know you had a guest on and you talked about orthorexia, which is a big problem. Disordered eating continues to be a big problem, and it will be in perimenopause because when women's bodies change, they start to restrict more or think that cutting things out really in a big way is the solution. And unfortunately, I think it just perpetuates a relationship with food that isn't good for
And then
people.
also can cause other problems.
And has other major ramifications. Yeah.
Okay. Lastly, vitamins. Obviously, a lot of people take vitamins.
Yes.
I guess where there's some confusion, because vitamins, like you can just buy them off the store shelf, are all vitamins created equally? Is there a specific brand, not that you're like paid by the brand to say it, but like, how do people know what a good vitamin is? Like if their doctor says you should be taking vitamin D,
I think,
what do I do? Like,
so with most of like the true like a vitamin, right? Like vitamin D or vitamin B12, honestly, there's only maybe 2 or 3 facilities worldwide that make these compounds. So there isn't a whole, even the companies might make you think there's a whole bunch of diversity, but there's not.
Okay.
They just put a different label on it and tell you a different story about how they packaged it together.
But it's really
but it's ultimately
like the pill's
from
the same,
like there's only so many facilities where these USP ingredients are made.
Okay.
When it comes to plants or herbs, I will say I think there's a bit more variation. There's not as much regulation as far as like where they're sourced, the actual active ingredient, which matters, so if there isn't the active ingredient from chaste tree, which is one of the most evidence-based herbal tools for PMS, you're not going to get the benefit. So I do become a bit of a stickler about using, making sure I teach women how to read labels, and you need to look for this language, this amount, but typically I'm not a stickler for brands. I'm like, you can get whatever brand of vitamin D. I really don't care.
Oh, okay.
It all comes from the same fucking place.
Oh, interesting. Okay, so and then just based on their branding is what determines the price. Because sometimes you think like the more expensive one's the better one. And here's the problem, right? Like when you get these bottles, there's so much writing on them, and most people don't have a science background or a medical background, and it's overwhelming. And it's like now left up to us on our spare time in life to like do all the research.
One more thing to do.
Like who has fucking time for that?
So I think naturopathic doctors who we can be well informed and help people on this front. And if you feel that it's worth the investment to help you avoid that confusion and homework that you have to do, we can take you through that. And honestly, sometimes the first thing I do with people when they have a laundry list of supplements is I take them off of them.
Got it. Do you think because some people are just self-prescribing and they're just like,
absolutely.
I heard you need this. I read in Women's Health magazine.
Yeah, and I'm not faulting. Like once again, often this is because we're wanting to feel better, and someone's telling us that this is going to make you feel better.
Or we're just scared for the future. Like I think sometimes I'm like, I'm just scared that I won't be healthy in what I do now, and everyone's talking about this new thing.
Yeah,
I should be taking it.
I think the biggest benefit is I'm very leery of messaging that makes it sound like everybody should be taking this because there's this whole, everybody will get the same benefit from it. I'm not of that belief. I think you deserve to have someone who takes the time to consider you as a person and your complexities and help you make those decisions with that in mind.
You're right. It's not as sexy, but it's the
not.
right
I'm sorry,
way.
it's
the
not.
right way to do it. And
Nuance.
so I so appreciate having you here because, I think this is part of the educating people, not on like, this is, Dr. Oz told me to take some gummy and now, everyone's going out and rushing out to get this. It's each person's unique. Each person's going through something.
It's not going to go away because that industry makes so much money. It's a business.
Yeah.
Right? It's a business.
Okay. Well, I hope we've helped some people debunk a couple things here today. Where can people find you? Because I'm sure people are watching and listening. They're like, I love this woman. I need her in my life. Where's the best way for them to connect with you?
I have an Instagram, but I don't use it, admittedly.
We'll still add it. We'll add it in the description.
I have my Instagram because I have a link there with respect to like how I practice. I have largely a virtual practice, so naturopathic doctors can treat anyone in the province that they're regulated in. So I treat women all over Ontario. I do virtual for that reason.
Be most of what you need.
We use actually our EMR, our medical charting system, has built-in video platform, so it's considered secure from an information point of view.
Okay.
Zoom is technically not, but anyways, so we use that, and I do in-person care in Owen Sound at the moment. That's where my practice partner is. I'm an associate at a practice there. But we'll include a link to the website, and that's where you can apply to be a patient. Once again, we specialize specifically in perimenopause. Menopause, we do a lot of menopause hormone therapy counseling, I'll call it, so helping women understand that option, that kind of thing.
That's awesome. We'll make sure to include all those links. Is there anything that maybe I either didn't bring up today that you thought I would and I kind of missed, or that you want to address, or just maybe some lasting thoughts that you'd like to leave our viewers and listeners with?
No, I feel like as the conversation goes, I think one thing that's continued to come up once again is, unfortunately, nuance doesn't sell as well, but I think I'm hoping that some women are sparked to think like, I should be looking for that, or I should hope that my healthcare team has an appreciation for that as it relates to them and their care. I will just say once again, like, don't settle for feeling less than yourself. There are options. You at least deserve to be heard. And I think sometimes the biggest thing I hear from the clients I listen to, often in the first visit, I'll tell them like, I'm not ready to tell you that you need this or this. Like, sometimes we need blood work first, right?
Yeah.
But often I'll get the feedback that like, you've made me feel that there's hope, right? And that I'm being heard and that I'm being listened to. And honestly, that's the biggest thing that they need, is just that, that I can't guarantee solutions on any front. Anybody that guarantees things, run away. They can't do that, right?
We always say that on the real estate side, right? When people say guaranteed returns,
no,
we're like,
you can't do that.
Run.
There's so many variables
like
involved.
Yeah.
Anyways, I'll just say once again, like, trust your gut, advocate for yourself, look up a North American Menopause certified practitioner if that's where you're at, and work with someone that understands that you are the best expert on your body, and they're there to layer in their expertise and help you land on what you need at that time.
I just want to close off on saying, like, obviously, what has happened to my sister-in-law and our friend as of late. I'm not going to go into details, but from a health perspective, she was very, very adamant about advocating for herself at the hospital. And doing so, I think, truly saved her life in the last couple weeks. And so had she not done that, had she not said, look, I just know how I feel. You're not inside of my body. You don't know what's going on. And so often, and I'm not saying don't trust the medical profession. Of course, I'm not saying that. But there is a time and a place where you need to say, I'm standing up for myself, and I'm going to get the answers I need, and I'm going to keep working at it. Just because you might not get the right answer that you want today doesn't mean that you shouldn't keep going down that path, and you shouldn't have people closing doors in front of your face. And so that was a great lesson that I've learned in the last couple weeks, because I would have been the person who just listened to the people at the hospital. And so I might have found myself in a very different position. So, down to that point of advocating for yourself, I think is so important. Thank you for being here.
Thanks for having me. I just want to say I love the show.
Thanks.
And I'm appreciative that you're having just women on and giving,
we're trying to give a
their
platform,
stories. I think
pass the mic around.
It's great.
Thanks.
I just think it's great.
And we always continue on with these conversations over a beer or
food.
Or a food. Yeah, usually it's food. But it's so fun to have my friends in this space, because oftentimes on weekends and you're just enjoying yourselves, you're not always talking about your careers.
Totally.
But I'm like, holy shit, like, I have really amazingly impressive friends, and what you do is obviously so incredible, and I'm very proud of you. I'm very proud to say that you're one of my besties.
Laura.
So thanks.
I'm proud of you too.
Thanks. And we'll see you guys next time.